Okay, good morning, students. So whatever I have taught you yesterday, so the remaining portion, if possible, if time is there, then we will try to complete till the management, okay, today. Let's see if it depends on the time. So am I audible? Once again, am I audible?
Yes,
Yes,
ma'am.
ma'am.
Okay. Okay, can you see the slide, all of you?
Yes, ma'am.
Yes, ma'am.
Okay. So yesterday we have discussed till the sign and symptoms. Now, so today, please mute yourself. So today we will be like discussing about the diagnostic evaluation. Okay. So first of all, the diagnostic evaluation is what happened is that in addition to a complete medical history, okay, as well as a physical examination, that like medical history means any kind of medical history, okay, like whether that person have any health history from before that medical history, and any physical examination, okay. Physical examination means like when you go to this hospital, okay, firstly physical examination is done, like they will see your vital signs, all these things. So your urine output, everything, physical examination that relate to physical examination. And diagnostic procedure for renal vascular disease may include, so in addition to the complete medical history, okay, as well as the physical examination that is done, the diagnostic procedure for renal vascular disease may include any or a combination of the following. So it might be only the medical history, or else it might be only the physical examination. So it includes these two combination, okay. So let us discuss. So the diagnostic evaluation means you can perform this, so arteriogram, which is also known as angiogram, and then the other one is duplex ultrasound, and then the other one is renography, and then the other one is magnetic resonance angiography. So you heard about MRI, right? And but this one, don't get confused. In case of like in case of this renal vascular disease, okay, the diagnostic evaluation that is performed is not the like MRI, it's the magnetic resonance angiography. So all of you like have any idea, anyone have any idea about what is arteriogram, duplex ultrasound, as you are already taught about the diagnostic evaluations before? So you have any idea about this? Anyone? If not, we will continue explaining. There is no issue, there is no problem.
Explain, ma'am.
Okay, okay. So arteriogram, okay, arteriogram, ये number one जो है arteriogram, which is also known as angiogram, हाँ, तो ये which is also known as angiogram. This is this X-ray image of the blood vessel, okay, जो हम जो blood vessel है ना, जो they take this X-ray image of the blood vessel, okay. So this is an X-ray image of the blood vessel which is used to check for aneurysm. तो ये arteriogram, that is angiogram ना, उसमें here how they perform is that they used to take the X-ray image of the blood vessel, okay, and then they used to check for any kind of aneurysm. Aneurysm means all those bulging, na, all these they used to check. So, and then narrowing or blockage, whether they used to check through that X-ray image, they used to check whether there is the presence of aneurysm or not, where there is a narrowing or not, there is a blockage or not in the blood vessels. So that is how they check. And so how they do is that a dye, okay, DYE, a dye का मतलब है contrast. A dye here क्या करता है? A dye is injected through a thin flexible tube, okay, which is placed in an artery. There is a thin flexible tube, okay, एक बहुत पतला सा बहुत thin वो फ्लेक्सिबल ट्यूब होता है, उसमें क्या करता है, दे यूज टू इंजेक्ट ए डाई, देयर इज a contrast. Okay, why they used to inject this dye? Okay, why they used to inject this dye? Because if you inject the dye, this will make the blood vessel visible on the x-ray. Because you know that arteriogram means this is the x-ray image of the blood vessel, okay, which is mainly used to check your blood aneurysm, your narrowing or blockage. क्या narrowing हो रहा है या blockage हो रहा है या all this aneurysm ना, all this they check. So in order to check all this ना, you have to inject through the flexible tube dye को inject करना है, and this dye will help you in in making the blood vessel visible, okay, on the x-ray. So are you clear, all of you? Arteriogram, all
Yes,
of you,
ma'am.
all of you. Okay. Whom will I ask? Ishan, can you please explain what is arteriogram? Ishan, can you please explain what is arteriogram? Just now I have explained.
I can't.
The rest student, please listen, okay, what Ishan is explaining. Listen carefully. Ishan, what is arteriogram? Okay, Ishan, what is arteriogram? You, oh, I think, student, can you hear Ishan?
Hello, ma'am.
Ma'am.
Oh, I think he have network issue. Okay, Ishan, no problem. Srijana, can you please explain what is arteriogram?
Ma'am, it is an imaging test that uses a special dye to see inside the arteries, whether the narrowing or blockage.
Yeah, means like it is mainly, you can simply call it, okay, all of you, you can simply call it that this is an X-ray image, okay. Here they do X-ray, okay, they take the X-ray, through X-ray they take the image of the blood vessel, okay. They used to check whether any aneurysm is present in the blood vessel, whether any narrowing is present in the blood vessel, or any blockage is there in the blood vessels. So in order to check, okay, the image, in order to check all those presence of aneurysm, narrowing, blockage, all these, they used to inject the dye, DYE dye, that is contrast. They used to inject this so that this dye will help the blood vessels visible more on the X-ray. So all of you, are you clear now?
Yes, ma'am.
Okay, it's very simple. Okay, next one. So this is the diagnostic evaluation. Okay, so next is duplex ultrasound. All of you have any idea about duplex ultrasound? Anyone, any idea about this duplex ultrasound? If not, I will explain. Any idea?
Explain.
Okay. Okay, duplex ultrasound, okay, duplex ultrasound. So this test is mainly used, test is mainly done, okay. It is mainly done to check the blood flow and the structure of the renal veins and artery. जो kidney ka veins, kidney ka arteries, all these, they used to check all this structure, all this, and then this, and the test is mainly done to check the blood flow. And then the term duplex, that is duplex ultrasound, to every one of you know na. So duplex ka matlab kya hai? This, the term duplex refer to the fact that two mode of ultrasound are used. Duplex ultrasound का मतलब है कि दो तरीका का ultrasound use किया जाता है. They use two type of ultrasound. Okay, so from the name itself you can say duplex means two type of ultrasound. So how these two type of ultrasound is used? The first ultrasound, the first ultrasound, they take an image of the renal artery, okay. They take an image of the renal artery, and then renal artery that is being studied, and the second mode, that is the second ultrasound, that is they use to check the blood flow. So that is how duplex ultrasound is being used. So are you clear, or I will explain again? You want once more, or it's enough?
Yes, ma'am.
Okay, so duplex ultrasound is what exactly? This is mainly the test, okay, that is done to check your blood flow, and as well as it is also done to check the structure of the renal veins as well as the arteries. So from the term this duplex ultrasound, it means that they use these two modes of ultrasound, okay, MODES. Two modes of ultrasound are used. So the first mode, in the first ultrasound, that is the first mode, they take an image of the renal artery, okay, and then in the second mode they check the blood flow. So are you clear, all of you?
Yes, ma'am.
All of you?
Yes, ma'am.
Okay, so next, let's move on. Next is renography, okay. This is renography. Check the spelling nicely, renography. So how this test is done, okay, this test is mainly, it is done this test is mainly used to check the function and the structure of the kidney. It is like quite similar with that of the blood ultrasound, but the way it is used is different. So renography means it is the test that is used to check the function of the kidney as well as the structure of the kidney. So it is just like that of the type of nuclear radiology procedure, okay? So that is how you need to know. So are you clear what is renography? Much detail about is not that much necessary, but you need to know at least a little bit about it. So are you clear renography?
Yes, ma'am.
All of you?
Yes, ma'am.
Okay, so coming to the next,
Ma'am,
after
can you explain?
again, okay, renography, okay, renography means this is the test, okay, that is used to check the function of your kidney as well as the structure of the kidney. They will check your kidney, whether your kidney is functioning properly or not, and they will also check the structure of the kidney, whether the structure of the kidney is proper or not, or it's inadequate. So are you clear?
Yes, ma'am.
Okay. Let's move on. Next is magnetic resonance angiography. Okay, this is a magnetic resonance angiography. So this test is mainly used as a combination of this MRI. So as a combination of MRI and intravenous contrast. Okay, the contrast means dye. जो dye use करता है that they used to inject ना to check the image to make the image visible. जब कुछ भी like well, like for example, when you take a picture, okay, to your camera, and if you want to make the image more clear or your photo more nice, then what you do is that you put some filter, na, to make it more clear or to make it more beautiful or whatever it is. You put some filter. So in the same way, this dye is also used like that. It is that dye is mainly the thing that make the image more visible and more clear. So we call it, we also call it as contrast. So do you know, do you understand the real meaning of DYE dye? All of you? All of you? Can you hear me, student?
Yes, ma'am.
Okay. Okay, so let me repeat. Okay, this magnetic resonance angiography mainly it is. This is mainly the test, okay, that is used as a combination of MRI, that is magnetic resonance imaging as technology, and as well as intravenous contrast dye, intravenous IV, intravenous contrast dyes. Okay, this true combination, that is MRI और जो intravenous contrast dye है ना, वो दोनों combine करके they used to see the blood vessels, or they used to check the blood vessels. Are you clear? Or I will repeat. What you just need to know is
Yeah.
that, okay, what you just need to know is magnetic resonance angiography means from in the name itself, they use two combination tests. Okay, the first is MRI, that is with they use a combination of MRI as well as intravenous contrast dye. Okay, they use. With a combination of these two tests, they perform this magnetic resonance angiography. They eat that two combination tests. After doing that test mainly used to help in seeing the blood vessels. Okay, with that test you can see the blood vessels. Any problem, any like abnormalities or anything is there, they see with the help of this. Are you clear? Are you
Yes,
clear?
ma'am.
Oh, okay, okay. So these, don't get confused about this intravenous contrast dyes. Okay, Joe, obviously when you inject some dye, when you inject some dye, intravenous means maybe they inject through the vein or whatever it is, intravenous. So these intravenous contrast dyes, like in this magnetic resonance angiography, what happened is that these tests, you know that this test is mainly done to see the blood vessel. So this contrast dye will cause the blood vessel to appear solid on the MRI. So when you inject the contrast dye intravenously, okay, this will help the blood vessels to appear solid, because when things are liquid, it is difficult to see, or if it is difficult to like make any like means any procedure unclear, so when something appears solid, for example, water and stone. So stone, when you see, it can visibly appear, so when the things are solid, so at that time means to make these blood vessels appear solid on the MRI image, contrast dye are being used. And then what happened is that the one who will perform this magnetic resonance test, MRI or MRI, whatever it is, so it will help the health provider to see the blood vessel very clearly. So these are the 4 diagnostic evaluation that you can use, okay, for this vascular disease. So are you clear, all of you? Are you clear?
Yes, ma'am.
Okay. Next is treatment. So we almost come to an end. Okay, there are special treatment. Special treatment you need to know. Means like special treatment means like special treatment will be based on means your healthcare provider, that is the doctor, will figure out. Okay, they will try to figure out the best treatment. Okay, the best treatment. So that best treatment, it will be based on what that we need to discuss. So next is specific treatment that is based on age. That means if someone have any kind of vascular disease, now first of all they will like try to see now what will be the possible treatment, what will be the best treatment. So based on all these criteria, based on all these following criteria, they will perform the treatment. So let us see what are all those specific treatment based on. So that is age, means they will see how old are you. Are you a child? Are you an adult? Are you an older age? First of all, they will see. Based on that, they will perform the treatment. So are you clear with the first this specific treatment? सबसे पहले they will see your age. उसके बाद decide करेंगे कि कैसे कैसे treatment करना है. So it will be based on that. So are you clear with the first point?
Yes, ma'am.
All of you are not clear, or what? No one is like responding, like everyone is silent.
Yes, ma'am.
Okay, next is overall health and medical history. So they will like the healthcare provider, now they will check your overall health and medical history. So overall health, before performing the treatment, they will check your overall health. Are you really in a good health, or else you have any kind of medical history? That means any medical history, you have already performed any surgery before, or else you already have before any kind of these diseases like kidney failure, or else whatever it is. So your overall health and your medical history, first of all, based on this, they will perform your treatment. And next is extent of the disease. So what your healthcare provider will check how sick you are, okay? Extent of the disease means how sick you are. They will check your disease. If suppose you are having any kind of disease that is related to vascular disease or whatever it is, now they will see the extent of your disease, means how sick you are, how unwell you are, how the extent of your disease is too much progressing, or else it is acute or it is chronic. All the extent of the disease they will assess. So, and then the next is tolerance of specific medication, procedure, or therapy. Okay. And they will, your care provider also will see how well you can handle the specific medication, procedure, or therapy. So, means any specific medication, if they will give you for treatment, if any procedure they will give you for, in diagnostic evaluation, we have seen so many procedure. Na? So any kind of procedure, if they give you, and any kind of therapy, if they give you, they will assess with your health condition, how much you can tolerate. So based on your age, they will say, based on your overall health, they will say, based on your extent of disease, all this, how much you can tolerate. And the next one is the treatment will also vary depending on the type of renal vascular disease that is present. So there are renal vascular conditions. There are 5 conditions, or the 5 types that I have discussed you all yesterday. Na? So based on based on the type of renal vascular disease, okay, the treatment will depend. So because there are different types now, for each type there is a different type of this treatment. So all of you, are you clear how the treatment will be based on? We did not till now come to the main treatment. We are just seeing before performing the treatment, it will be based on what they will check before performing the real treatment. So are you clear?
Yes, ma'am.
All of you?
Yes, ma'am.
Okay, so now let's come to the main point. So treatment means, suppose you already know about the 5 conditions. What are the 5 the types of renal vascular disease? So the treatment also will be based on all those types. The symptoms also will be based on all those types, because for one particular renal vascular disease, the symptoms is different like that. So in the same way, the treatment is also different. So we have to see. So one is, what was the first one that we discussed? That was renal artery stenosis. Now we have already discussed about this. What is the meaning of this? And if someone have this kind of problem, what were the symptoms? We already discussed. Now what we will discuss is that if someone have renal artery stenosis, how you will give the treatment. So first of all, there is a medical treatment. So in this case, there is a medical treatment as well as surgical treatment. Medical treatment means treatment with the help of medicine, and surgical treatment means treatment with the help of surgery. So let us discuss the medical treatment. So antihypertensive medication other than angiotensin converting enzyme inhibitor must be used to treat high blood pressure. So here hypertension, high blood pressure medicine, that is antihypertensive medication we call now. So this antihypertensive medication, so many are there that need to be provided, okay, in order to treat high blood pressure. That will be the medical treatment. And then the other one is in stenosis, because it is renal artery stenosis. Now stenosis, you already don't know. If in stenosis, which is caused by atherosclerosis, you know now atherosclerosis means. So in stenosis, which is caused by atherosclerosis, okay, medication to lower cholesterol may be prescribed. So in case of stenosis, okay, which is mainly caused by atherosclerosis, you need to prescribe a medication to lower cholesterol, okay, this cholesterol. So this need to be prescribed. So stenosis ko kam karwana hai to cholesterol, you have to prescribe medication that is lower, that can lower your cholesterol level. And then agar kisi ka BP high hua to you have to prescribe antihypertensive medication. And then the other one is treatment of related medical conditions such as diabetes. So the person who is having this renal artery stenosis, so if he is also having a health problem of diabetes, so you have to give the treatment, okay, that is any kind of treatment you will give any kind of medication that can that can reduce his or her glucose level. That is treatment of related medical condition. Okay, this diabetes, there might be different medical conditions, but diabetes is common everywhere. That's why I have given this. So next is surgical treatment. So now, sir, endovascular procedure. Okay, endovascular procedure, that is uska matlab is such as angioplasty or placement of stent. So endovascular procedure such as angioplasty or placement of stent. This is the procedure that is performed. Okay, renal artery stenosis. वो stenosis को remove करने के लिए ना, they perform a procedure, and the name of that procedure is this angioplasty. Okay, or else they also place a stent. They also used to place a stent. So like this angioplasty का मतलब है ना, angioplasty means this is the opening of a renal artery. Okay, they used to open the renal artery using a balloon or other method. They used to use some kind of instrument. Okay, they using a balloon like that, not the balloon, okay, that we normally purchase, not that one. There is an instrument. Okay, they mainly use a balloon or any other method in order to open the renal artery, because you know there is a stenosis, there is narrowing now, so they will try to open the renal artery. So with the help of this angioplasty procedure, the renal artery is being opened. And then, or placement of a stent. Okay, stent ka matlab hai, this placement of a stent means it is a tiny, okay, expandable metal coil which is placed inside an artery, okay, to keep the artery open. So they also put some stent, okay, stent to open the artery. Okay, this, it is a coil, like it is an expanded metal coil. So artery ka andar pe, like inside the artery, they used to place this so that the artery be visible and the artery be opened. So Srijana, please take attendance. Okay, are you clear with this surgical procedure, endovascular procedure, that is angioplasty? Are you clear?
Yes, ma'am.
Okay. Okay. And next, open surgical procedure to bypass the blocked renal artery. So here they also perform an open surgery. Okay, open surgery means, you know now, open and close. Obviously open, close surgery is also there, and but here open surgery means to incision, to the cut. Okay, to directly they cut. Close surgery is different. So, or to the open surgical procedure to bypass the blocked renal artery. So open surgery is done to bypass the blocked renal artery. So this is all about renal artery stenosis and how means how the treatment can be performed. Medical treatment as well as the surgical treatment. Here, just know the important one. If BP high, give antihypertensive. If there is stenosis occur, stenosis means if this occur, you need to try to lower the cholesterol level. So you need to prescribe such kind of medication that can lower the cholesterol. And then if someone have diabetes, you will based on the medical condition, you will give the treatment. And then it's a surgical treatment. The surgical is the name of the surgical procedure is endovascular procedure, which simply we call it as angioplasty. And angioplasty means here mainly the renal artery is open. Okay, we using a balloon or any other method. Okay. And then your placement of a stent means they will place a tiny expandable metal coil. Okay, they will place coil ka jaisa hota hai, expandable metal coil, okay, inside the artery. Here also same thing, they will try in order to open the this renal artery. So I hope all of you are clear with this first types or first condition. All of you.
Yes, ma'am.
Okay, there is still some minutes, so let us continue. Okay, next is renal artery thrombosis. Okay, so this renal artery thrombosis in acute situation or cases. Okay, in acute means not the chronic. इतना ज़्यादा भी वो problem नहीं हो रहा है. Okay, in acute situation or cases, thrombolytic, that is thrombolytic means there is a clot busting. Okay, medication may be infused into the renal artery for several hours to several days to break up the clot. So thrombosis, so you all already know, na, thrombosis. So what was thrombosis, Srijana? What is thrombosis? Darshana?
Blood clot.
Yes. In acute situation or cases, thrombolytic, that is clot busting medication. Okay, they used to give this thrombolytic medication, that is like the medication that can break the clot. Okay, so these medication are being given, may be infused into the renal artery. Okay, it may be infused, it may be given directly through tablet, or it may be infused, okay, into the renal artery for several hours. They might give or infuse for several hours, or if it doesn't, the problem doesn't get better in several hours, it might take several days, okay, to break up the clot. And then surgery, that was the medical part. Okay, so and then again, surgery is surgery to remove the clot or bypass the artery may be done in some situation. Means like surgery is not that preferable, but if the problem is chronic, or if the problem is too much, like it's being progressing now, so in at that case the surgery might also be performed to remove the blood, to remove this clot. So are you clear with the renal artery thrombosis treatment? Remember thrombolytic medication, okay? This is used. Are you clear?
Yes, ma'am.
All of you? All of you, are you clear?
Yes, ma'am.
Okay. Next, renal artery aneurysm. On your aneurysm, all of you know na, that bulging. So treatment of a renal artery aneurysm depend on the symptoms and the size and the location of the aneurysm. So aneurysm, you know, it's bulging. Na? So and then I already showed the picture also how it looks like. So the treatment of this renal artery aneurysm, now it will depend on based on the symptoms as well as based on the size. So the size, how much it is, and how the size is small, the bulging size is small, or else it is large, and as well as in which location it bulges out. Okay, in which all this they will check. And then some smaller aneurysm may not be treated, but may be watched for growth or problem. So if the aneurysm is very small, okay, so in that case, the treatment might not be necessary, but you still have to watch for growth or problem. Means at first when you watch, it was the aneurysm was small, but slowly and steadily, without giving any treatment, if the aneurysm progress, okay, if it progress, then what you need to do is that you need to perform, or you need to undergo medication. So for that, you need to watch for the growth or any kind of problems. And then surgery may be used to treat larger tearing or growing aneurysms. So you have to keep on watching this aneurysm. Okay, so if the aneurysm is becoming larger and larger, okay, and then it became so large that it's already like tearing, okay, tearing already occur, and even it's keep on growing and growing, then in that case surgery might be performed, because in that case medication will not work anymore now, because it's too large. So surgery might be performed. So it may also be used for aneurysm causing lack of blood flow to the kidney, because there are some aneurysm, okay, but in some part there is a bulging occur, but what happened that is that might cause lack of blood flow to the kidney. So and also it might also cause high blood pressure and aneurysm causing symptoms. So surgery may also be needed in all these cases. So this is all about renal artery aneurysm. It's very simple. So what you need to just know is that it will depend on the symptoms. Now it will depend on the size, and it will depend on the location. So size means if smaller size, then the treatment might not be necessary. Might not be needed. You need to just watch for the growth or any problem. But if the size is very large, okay, in that case, or tearing already occur, and then the aneurysm is keeping on growing and growing, okay, and then if the aneurysm is causing the lack of blood flow to the kidney, okay, because of that bulging, now there might be lack of blood flow to the kidney, because if it keep on bulging, if some problem is there, then obviously there will be problem of blood flow to the kidney now. So in that case, if it is making the blood flow problem to the kidney, in that case also surgery is performed. And if that problem was aneurysm also cause high blood pressure, then surgery is required. And if the aneurysm is causing symptoms, then that also surgery is also like necessary to be performed. So are you clear, all of you?
Yes, ma'am.
Okay. Okay. The only 2 more left, but it's okay for today. Tomorrow we will totally complete this. So, Srijana, are you done with attendance?
Yes, ma'am.
Okay, then thank you everyone for today. Okay, then I will upload the class, even yesterday class now. Okay, then thank you everyone.
Thank you, ma'am.